Wow, okay, that was a short one. A very good afternoon, folks. Let me check my calendar today. It is actually Wednesday. Happy Wednesday to everyone. Selamat tengah hari diucapkan kepada anda semua. Thank you so much for coming back and watching our awesome Act Now show. What's for lunch? My name is Mio Adlan, and I will be here together with you every single working day from Monday to Friday at 12 p.m. So hope you guys are actually having a good day so far. Hope you guys are having a productive day of the week. It is in the middle of the week. It is neither Monday, neither it is Friday yet. So, you kind of like have that feeling where, yeah, it's the middle of the week. Weekend is nearby, but I just started working. But yeah, I do hope we at Like Now do hope that you guys are having a very prosperous and a great day and looking forward throughout the whole week. All right, we're back on Act Now, where we cover all of the latest issues, whatever it is that's happening in our beloved country of Malaysia. Isu apa yang panas, isu apa yang hot, isu apa yang awesome. And of course, I am not doing this alone. I'm together with my partner in crime. Tak elok nak cakap crime kan, macam jahat juga orang dia. Tapi walaupun muka dia macam gangster, tapi dia sangat lembut hati dia. A very nice man, a very cool man in the name of Melvin Lam. Melvin, appear. There you are. Hi, Melvin.
Hi, how are you?
I'm doing good. You miss me giving your introduction like this, right? I mean, for the past 2 weeks, nobody has been giving you such introduction, right?
Yes. Can I request drum roll from tomorrow onwards?
You want drum roll? I give you drum roll. Just for Melvin Lam, tak ada hal. I got you sorted, brother. It is definitely something that we can do here. So, how have you been? How has your Monday? How has your morning been? Has it been productive? Ataupun you macam lazy je, duduk rumah je, tak buat apa-apa je?
No, it's getting more excited because I have a good feelings that the office will be open soon. Well, it came up in the reports that the group said, yes, we should reopen our economy soon. And we this is a 4th month, June, July, August, September.
Yeah.
I mean, how you feel? You'll be in the room for 5 days. This is your 5th day, right? In so-called isolated yourself. How you feel? You actually tell me this morning you feel a bit tired. Your eyes, I mean, I'm not tired as a physically, mentally tired. I can see that from your eyes.
Yeah, I'm just saying that I'm glad that the walls are strong and concrete enough, because if not, my head would definitely be banging the wall like multiple times already. But let's not talk about my condition, because we want to talk about the nation's condition. That's what we are in here today with Act Now. We want to talk about what has been going on with Malaysia and the current situation with the COVID-19, obviously. And first topic that we want to bring to all of our viewers out there is actually a very serious topic in regards of COVID-19 and how the death rates are becoming a bit more stagnant and at a higher number at that. And what we want to highlight today is with the brought in cases. For your information, ladies and gentlemen, folks, our viewers, brought in dead cases are cases where the victims, or should I say the people who got COVID-19, who suffered by the COVID-19 virus, were unfortunately brought in dead rather than getting treated or getting their life support done in a hospital. Unfortunately, they have died in their homes or on the streets or whatnot. and the numbers have been quite staggering, Melvin.
Yes. It's an average 10 to 20 people that's brought in dead. And you know what? They actually, those disease have they're tested positive, but they have not. They were in category 1 and 2, and they do not display. So they display minor symptoms only. Like cold or fever. And that's scary because they never know they actually develop into category 3 or 4 eventually. So so like it's a silent killer. You thought it's a mark. Okay, I can self quarantine at home and all those things, but it's actually developed more serious, and it might also spread to your family members or your housemate, for the matter.
Yeah, exactly. As what the newspaper article that we're showing you right now, as of Friday the 13th, I mean, that's actually a very freaky date, as that it was reported that 277 fatalities was recorded the day before, with a high record of 96 brought in dead cases. I have friends who are in the health industry, who are doctors, who are nurses, working around in government hospitals all around the Klang Valley specifically, and the stories that I hear from them, that it is actually that the number of people that were brought in dead is actually at a very alarming rate. And as what you mentioned, they don't display any serious symptoms. They don't display any critical condition. They just unfortunately drop dead, or they don't even realize that they have it, and it is just gone like that. And it is a very unfortunate thing, because they didn't even given the chance to fight this COVID-19 virus. I mean, if you're in level 4 or at level 5, you're given the life, you'll be intubated, you'll be given life supporting help at the hospital, but these guys unfortunately not even given a chance, and it's very saddening, Melvin.
Yeah, it's true, because that's why the authorities, there's a call from the public that to seek the Health Ministry to review its procedure for COVID-19 home quarantine patients. I guess I don't know, have not heard anything from them yet, but I think they should renew what's the procedures. Probably more frequent or daily visits to these people, or they ask them to check them, because it's like a silent death. I have seen cases. Through the Facebook, people actually collapse on the roads, and this probably that they do not even know they have COVID-19. Probably they could treat it. A mild cold or fever, they just go on, but there's no so-called urgency or alarming factor that tell them that I have to go to the doctor and check myself.
Yeah.
Especially, I think,
and just to
sorry, cases more like I seen it in the posting, more elderly persons, because they treat it like it's just a normal at my age, I have probably a bit cold, a fever, slight fever. So they took it lightly. That's right. That's what
it is. It is very sad. And let me actually share with you the current numbers. What was the latest numbers that were posted by the Ministry of Health, KKM, Kementerian Kesihatan Malaysia, as of yesterday, the 7th of September? There were 311 cases of death related to COVID-19, and Selangor actually posted the highest number, which was 55. And there were 178 deaths of men, 133 of women. Comorbidity was about 220 cases, and 91 showed no comorbidity at all. And get this, as what we're talking about today, the brought in dead cases of yesterday, I'm not talking about the day before or last week, was 93. That is a very high number indeed. 93 cases that were brought in dead. 218 died in the hospital. It is still, as much as we are happy right now that businesses are opening, SOPs are being loosened up, you could actually go out, enjoy a meal and whatnot, but still death cases are still happening at a quite high number, 311. It is just it is very scary indeed, Melvin.
We have 24 hours a day. It's more than 10 persons. It is more than 10% people dying every hour. And that's why I have these mixed feelings. Yet, I like the economies to open up with a new SOP, strict SOP, which I pray everyone please follow. But yet, looking at every day, the figure or the death rates has been increased. Of course, yesterday, YBKJ says some of these numbers are backlog number because a lot of cases that they have not the so-called they have not tested whether they died of the COVID-19 or not. So it's quite a number of backlog, but it's still a high number. We need the economies to recover, and the message I think is we have to take care of ourselves.
Yeah, exactly. I mean, like, all that we can do as citizens of Malaysia, we again daily, day in and day out, we advocate the vaccination program. We urge people out there to make sure that they get themselves vaccinated, because as per recorded, unfortunately, a lot of these cases, death cases, are people who has not been vaccinated. They unfortunately have not completed their vaccination program, and that's one of the things. I mean, cases show, statistics show that when you get yourself fully vaccinated, God willing, you will not succumb to these kind of situations again. There might be cases. We're not saying that it's 100% guaranteed, but you're lowering down the risk of getting those serious conditions in stage 4 and 5, or even having to meet death, if I may say so. Oh my God, this is such a heavy story. But again, we are pleading to all people out there to make sure that get yourself vaccinated. I'm getting a bit teary-eyed here. We start off with a very, very, very hard topic, Melvin, but it is something that we have to talk about, right?
Yes, we have. It's a concern. I mean, we have to remind the listener, our viewers. I hope the viewers, the listener, also share this. What we feel, agree with us, and share it to your friends. To your family, to your friends. It should be like my parents, when the olden days, when you come up from the house, you go to school or you go to work, they will tell you, oh, please be careful, drive safe, don't drive fast. I think it's the same thing now. We have to tell people who are out from the house, hey, be careful, don't go to too crowded areas, stay safe. It could be repeat every day. But do not say that it's too long-winded. We want everyone to be good.
Yeah, definitely. We want to make sure that everybody is in the same boat, because we are in the same boat. We are in a huge, gigantic boat called Malaysia, and we want everyone in this boat to be as safe as they possibly can, to get all of the best care as they possibly can get, because we are satu keluarga, one family. Correct or not?
Yes. Not only Malaysia. I think I remember this last 2 months, Prince Harry actually make which I agree, where he actually make a statement. Anyone in the world, in the world that contacted positive affect us directly or indirectly. Not just Malaysia. Let's say our neighboring country as well, because that's now the virus. They don't need passport. They do not need quarantine.
They don't need someone at the immigration office to just like chop their passport. Like, okay, what's your name? My name is virus COVID-19. Okay, here's your passport, chop and get in. I know it doesn't work that way. Exactly.
Yeah, they are free to travel.
Yeah, so, exactly. That's why we need to make sure that the people at the front line at the immigration office make sure that they stop all of this thing from coming into our country, or even if they come, at least they are properly managed and properly taken care of as much as possible. Okay, let's drop this topic right now. Again, we don't want to be too down. We don't want to be too serious. I mean, like, it is serious anyway. That's what Hot Issue is all about, talking about serious stuff. Exactly. But yeah, we're moving on. We're going to be talking into our second topic, which is about quarantine centers, because the government has urged to work with private sectors to set up more COVID-19 quarantine cases to facilitate foreign workers as well as those who are in the B40 group. Because like it or not, at the end of the day, right now, it is a reality that quarantine centers, the paid ones at least, they're not cheap, Melvin. You have no
I don't know how
idea
much
how
you're
much I'm
paying.
actually paying for this particular quarantine that I'm in right now. I mean, I'm fortunate that somebody is actually putting up the bill on this, but the amount is quite heavy, and not a lot of people can actually afford this kind of thing, Melvin.
True. You say you have a nice room for yourself. You have at least 3 meals by yourself. Everything is served. They bring the food and ding dong. Then you open up the door. Nice foods are served to you.
I've been telling you too much about my quarantine place now, Melvin. Yeah, that's for sure.
I don't know what other room service they provide you.
All right, no, we don't want to
Why
go
does
there.
it not?
Let's stick to the topic. Stick to the topic, please.
So yeah, just out of curiosity, do they come and make your room every day?
Oh no, no. Nobody comes into my room. I don't get to change your towels. Whatever towels and amount of soap that I get, that's the amount that I'm going to be living with for the whole duration of my 14 days quarantine. So nobody
Oh,
comes into my room except for myself.
okay, okay. I was just wondering whether they clean up, make bed for you, all those
Uh,
lah, all those pampering you, tuck you to bed.
Moving on to your point, please. Let's get away from my
Okay, all
situation.
right. Okay. We need some fun elements in a
Mm.
dark topic in a
Yeah, you're having fun, definitely. Okay, let's talk about the B40s here, the foreigners here.
yeah.
Let's talk about that. Let's give them the highlights. So, what's going on, Melvin? What's your point? What's your take on this matter?
Yes, because the V40 group, that's probably they have a small they stay in a flat or small apartments with few,
Mm,
So if one of the members they tested positive and they have to home quarantine, I think it's very inconvenient. It's they need a room by themselves, and uh, look at those industrial workers, those in the factories. They are
mm.
staying in dormitory. If
Yep.
that group, some of them have contacted positive, it's easily spreads. That's why the findings that among these factory workers or the B40 groups, the spread rates is faster. Getting from the infected workers, the colleagues, and all these things. So the government or some state government like Negeri Sembilan, they actually in June 9, Negeri Sembilan has actually opened its first privately run COVID-19 integrated quarantine and treatment center. So they turn into a
Mhm.
center that's like even a factory that's not used, they try to turn it into as a quarantine center or something like that, so that these affected people do not need to send back to their own homes.
Yeah. Yeah,
And
I have a point on when you want to talk. You just mentioned yourself about the home quarantine. I was given the opportunity to apply and have a home quarantine rather than having a hotel quarantine instead. But
yeah,
the SOPs, or should I say, the requirements are very stringent. It is very strict because the health ministry, the ones who are involved with the HSO, they want
yeah,
to know how many rooms you have in your house, how many bathrooms you have in your house, and do you even have access direct to that particular bathroom? Who is living with you? Do you have any small kids at home? What's the status of your partner, your wife, or your husband, or whatnot? These are the things that are being considered should you want to have a home quarantine. Even though I am fully vaccinated, I got double dose already of AstraZeneca, but I could not actually have a home quarantine because I have a child living at home together with my wife. So that's definitely a deal breaker for
yeah.
HSO, for KKM, to actually reject my application to have a home quarantine. Hence why I'm doing a hotel quarantine right now. And again, as mentioned, I'm quite blessed. But imagine for those who can't really afford even having to pay 150 ringgit a night for 30 nights for 14 days. That's a huge chunk of change. And we do know right now that in the current economy right now, a lot of people are not actually working. Some of them are unemployed. They have been, fired from their jobs due to COVID-19 situation. And who can actually afford 2-3,000 ringgit just to pay for hotel bills? Hence why
Yes,
I think this is something that the government and the private sectors need to look into and hand in hand help each other, right?
that's true. And then the government is actually doing something. They seek public donations or from corporates, and they allow them to have this as a tax deductions in the annual finance. I mean, income tax.
Mm,
So they're putting government is doing something. Of course, they hope the corporate citizens and the rich can also do their part. So they incentivize by having this amount being tax deductible. And something I like to, and Nestle, I like to also Nestle has a good corporate CSR. They actually launched Nestle quarantine transit stations in Picasso's hotel to ease the burdens of the healthcare facilities in Shah and nearby areas. And actually, Nestle is actually footing the bill. The cost of the facilities will be fully borne by Nestle, offered to the B40 groups, of course, to the employees and to the B40 group. So this is a very good initiative, and I hope more big companies will also follow the same.
Yeah, I mean, with this kind of action, I mean, we can't do anything but applaud Nestle for whatever they're doing. They're really taking care of their employees because they know for a fact that their business, even though they're a huge conglomerate, they're an international company, they cannot function without having their own employees around because they, like it or not, they need employees, they need people to run their business as well. So kudos to Nestle in taking care of your own, in taking care of your own employees and making sure that they're getting all the benefits that they can get in this very trying times here in Malaysia. And I believe there are plenty more of other companies out there. It's just the fact that they're not being mentioned in the press, they're not being mentioned in the media. But I honestly believe there are many, many more companies out there who are doing the same thing as well, who are treating their employees very, very well, giving all of this extra, help when they possibly can, right? I believe there are people like this outside more there, right?
I hope so, because they have to understand the people they employ is the one who make them, who actually build the company, to make the company better. So you have to take care of your own staff. I hope this is something, a wake-up call in all sectors that employ mass, so-called a lot of factories or in the construction sector. Please take care of them. They're the one who built your empire. A lot actually wants to profitize from them. Give them that kind of accommodation that is not hygienic and all these things. So give them, because these are the one I say build your empire. These are soldiers that you need to take care, so they will fight for you. So I hope that this policies applies in all sectors from now.
Yeah, exactly. That's what we wish for. That's what we actually hope for. We want more collaboration to be done between the government as well as the private sectors. I know that both parties are suffering right now, lack of income, lack of source of getting their books done properly because of the shortages and whatnot. But at the end of the day, it's all about humanity, it's all about the people and trying to do the best that we can in helping each other. Done with topic 2. We are done with the 2 major topics that we have. But yeah, we are not actually done yet for today's episode because why? There are still a couple of things that we want to talk about. Apa yang kita nak bincangkan, apa yang kita nak lontarkan kepada anda. Skemanya bunyi saya sebenarnya bila saya cakap bahasa Melayu. But it is all about just sharing with you guys what are the latest stories out there. And Melvin, you boleh pergi tengok wayang dah, Melvin. You dah boleh pergi tengok wayang.
To tell you the truth, for the last few years, at least 3 years, I not stepped into a theater before. At least 3 years. At least 3 years.
Yeah. But it has been announced by the government as well as by our Prime Minister that the industry, the entertainment industry, to reopen for fully vaccinated people under the NRP's phase 1 from Thursday, 9th of September. And we're not just talking about cinemas, we're talking about the creative industry. People who, do films, they do commercials, they do TV shows, they do singing, they do shows and whatnot. People are able to get back to it, granted with SOPs, but they're able to open up business and get going. Good news, right?
Yeah, good news. I think even the live performance, they say the lounges in the hotel can open. There, of course, there are certain different level of capacity. I mean, cinema, they only allow maximum 50% capacity. Broadcast live studios, 30% capacity. indoor busking hotel lounges, 50% capacity. So this is the SOP, the new SOP. I hope the operator need to follow strictly. I'm actually quite skeptical because especially those lounges, after a few drinks, everyone seems to rude to each other, which happens, when
Spoken from experience, is it? No, it's not.
Probably from experience. The first drink, probably you are a meter away. After the few drinks, you are 3 mm away. So I hope that those patrons going in, please pay attention. If the operator see you too close to each other, I hope the operator just step in and tell them, dear sir, madam, you're getting too comfort. You're taking too close to comfort. Please have a 1 meter apart.
Exactly. This is what we're trying to live with right now, Marvin. I mean, like, as much privilege or as much loosening up of the SOPs the government is trying to give right now, we know for a fact that in the next few days when these things are open, you're gonna hear people, getting too close to each other, hugging each other. Like you said, from personal experience yourself, it is quite hard when you're already under the influence and you're having such a good time. You tend to forget the SOPs that's happening. But we do hope that this is actually just a start. I mean, people out there, we want to remind you guys that this is what we're trying to do. Even though that we can't get back to normal instantaneously, like 100% of how it was before, but at least slowly we're getting there. All you guys need to do is persevere and just follow. If you want to have a good time, you still can have a good time, but with proper control of yourself. I don't know how you're going to do that when you're under the influence, but yeah.
I'd like to suggest, I hope the Prime Minister or the new chairman of the NRP, Tan Sri Muhyiddin, listens to this. We should have posters, let's say in the cinema before the show starts, have this posters telling people do not of the new SOP. In the lounges or in the restaurants, they must put out posters in the hall or in the entrance.
Yeah.
Strict SOP have to be observed. No hugging, no kissing, no all these things. So that it's a last minute so-called reminder before everyone step in.
Yeah. That's what Malaysians are famous for. We always need to be reminded every single day, every single moment, every single minute. Actually, we always need to be reminded because it never really sinks in. That's why you need a figure. I mean, like an imaginary hammer just to knock that thing in your head as deep as you possibly can. Yalah. Kalau you ketuk my head sakit sikit lah. Kalau ketuk rambut kepala you okay sebab you ada rambut. I macam sakit sikit. Okay, that's about the entertainment industry being fully open very, very soon, which is tomorrow. But another one that we want to also point out is the fact that malls and other business places are actually able to open. Departmental stores, your shopping malls in phase 1 specifically is all about coming back to work for the workers, for the people who work in shopping malls, and it's definitely something of a new norm for them because it's been a while since malls are fully operational, and it is sort of like a good thing already that people are able to have that source of income already and coming back to a little bit of normality moving forward. Melvin, good news.
Yeah, I hope so. It should be fast. I actually last 2 days ago, I went back to the office. It's not too far away from my house. I just there to clean up because I have this anticipate that it will soon reopen because most of my colleagues are, in fact, all my colleagues, we are not a big office, all have been fully vaccinated. So those admins office, probably I hope the government allow us to open. The groups have been calling, even like shopping mall. I mean, now the theaters, let's say, for instance, the mega mall, they have theaters allowed to open, the lounges there allowed to open, the restaurant there allowed to open. It just would also allow the fashion retailers, leisures retailers to open up. Probably with the SOP, they say, yes, the shop only 30% capacity, likewise, like the cinema hall, 50% capacity. And it's good, probably they have to sit separately. Even you come in a couple, I
Yeah.
imagine that I allow you come buy 2 tickets. Yes, it will be separate in between a seat. You just hold hands,
Yeah.
you know. You want to go dating.
It's like that, right? It's like so far away, you have to hold hand like that. Like you cannot. I mean, like imagine going dating in today's day and time. You know, the teenagers, you know, the college kids. Hey, I want to bring you. I want to go dating. Like, let's go watch a movie. Then you're gonna be like holding hands like that, like so far away. But that's how life is right now. That's how the
Yeah,
world works right now,
because
and people need to respect that.
yeah, you know, like in cinema hall, for the few hours, you ought to be sitting concealed in the aircon room. Imagine if
Yeah.
I would get this for fear. If someone at any corner sneeze,
I think you're gonna be super paranoid, way. Seriously, if
I
like
would probably be the
two
one
rows.
I would probably be the one who would probably drop to the floor. You know, you're
Exactly.
fine.
You'll be like sitting there trying to watch Avengers or whatnot, and then suddenly like achoo, coughing. You're gonna go like, what the heck is going on? No, no. You're gonna be like super paranoid. But yeah, that's the norm, Melvin. That is definitely the norm. But we do hope
Probably,
that
I think if an
slowly.
aircon room it's cold in a theater room, insist them to wear the mask as well.
Yeah, yeah,
I think that should be the SOP.
definitely.
I think the government should think on this. Yes, you're not there to eat or smoking or drinking. Yeah, you're watching let's say 1-2 hours, and you'll be
Yeah,
there. Have the mask on. Insist that they have the mask on, because anyone can sneeze, or they will have a running nose. They
yeah.
might not have
Uh,
that, but people will get panic.
Melvin, for the
Yeah,
7-hour total flight from Kuala Lumpur to Tokyo, I had my mask on fully, as well as other passengers as well. Because
good for
we're in
you.
a closed, confined space, and it was actually a mandatory. It is not, I mean, like, obviously, I would wear it, but it is also a mandatory thing that the airlines kept on reminding that making sure that you have your mask on. Apart when you're eating or drinking, you always need to have your mask on. It is the new norm, like it or not. We don't want to come to a point where we had to wear oxygen masks with tank behind, like like all those scary sci-fi movies. We don't want to do
Yes,
that. So just follow the SOPs that we currently have. It will be better. Hopefully, touch wood, we will get better. And yeah, we've come to the end, man. Wow, a lot
right.
of things that we have to talk about today. Oh my god. Banyak gila benda nak cakap, but it's definitely for all of our viewers, information for all our viewers. Um, you know, yeah, they need to know what's happening out there. It is our responsibility to share with them all the hot issues, Navin.
Yeah, sure. So I see you
All right,
tomorrow.
so
Have
I'll
your
see you
good
tomorrow,
lunch.
same time, same place. Thank you so
Yes,
much. You take care. Bye bye.
you take care too. All right.
All right, guys. That's it for this episode, for today's episode. Make sure you guys follow us on Facebook, and make sure you guys actually download the Act Now mobile community app as well, because that app is wonderful. It gives you a lot of capabilities. It gives you the opportunity to actually lodge a report within your area, whatever what is happening. And also make sure you guys follow us on Spotify as well as Apple Music for our latest issues of podcast. Mio Adlan here, signing out. Hope to see you guys again tomorrow. Take care. Happy lunching. Goodbye.